After a hit early in the New England Patriots game versus the New York Jets on Sunday, tight end Rob Gronkowski started experiencing back pain and leg pain. He's been diagnosed with a herniated disc in his lower back. Now, this is what your disc and spine look like. Your hips are down here, your base of your skull here, and in the back, you can sort of feel these little ridges. Way down at the very bottom, towards your tailbone, which is down here, you've got the lumbar spine. And 95% of the time, you herniate where this red thing is or just below it. This lower part of the spine. Now, these bones are hard. They rely upon these little donut-like discs to be able to cushion the spine. But when you get hit hard or you're moving the wrong way aggressively or even lifting a bag sometimes, you can hurt your disc because these discs can herniate. Now, Gronkowski is going to undergo surgery today. Herniated discs are pretty common. Most of the time, they resolve by themselves. But because he's getting surgery, it probably means he had experienced more severe neurological symptoms. Some studies, in fact, show that being tall probably puts you at a greater risk for herniating a disc, requiring surgery because you're bigger, the discs have to be wider, and you've got more torque as you lean forward. But let's go over what's going on with Gronkowski. He's 27. He's already had 2 surgeries for herniated discs in his back since his final year at the University of Arizona. That was in 2009. This is going to be his 3rd surgery. And it took him a little longer than 8 weeks to recover from those other surgeries. And usually it's a little longer each time you have to have surgery on your back. But let me explain what's going on here. The spinal disc lies back in here, and in multiple layers coat it, and then in the very middle there's like a soft jelly-like consistency material. So think of it like a donut, a jelly donut. The spinal column that you can feel is way back up there, and this is the nerve column. That's the big issue here, because when you rupture this little disc, it often will rupture, as this image shows, in an area that allows the inner soft, gooey jelly material to squeeze out, and that causes lots of inflammation. That compresses on nerves nearby, irritating them, causing pain and sometimes numbness. That's why you get the pain in your bottom and down in your leg. Herniated disc surgery usually involves cutting out a part of that herniated disc, which you can do in many different ways. You can do it with an open incision or through a needle, minimally invasively, but the recovery time depends on how big of a cut the surgeon had to make. Generally speaking, 2 months is reasonable. That's why the team says that Gronkowski is going to be out for the rest of the season.
If you like what you just saw and you want to see more videos of your favorite athletes, crazy stories, and just all the best off-the-field stuff, subscribe to the TMZ Sports YouTube channel.
The subscribe button is right here, and check out more of our exclusive content right here.